Hey guys, Chandler here, back on my channel, Alternate Journey, and today I am 2 months post-op top surgery. This last month went by really fast. I definitely have a lot more mobility and reach. I'm actually able to basically put my hand up above my head, although there's a lot of tightness, especially the more back I go, so I don't typically do that motion a lot. But it's still good to do that occasionally, just as physical therapy and everything like that, so you don't have such a shortened range of mobility. You still want to move in order for your body to heal properly. You just don't want to break that line where you're doing it too much, where you're stressing your body out. So just make sure you're listening to your body and stuff. My right side, like I mentioned in my 1 month video, is still healing at a slower rate than my left. With mobility, there's a lot more tightness still, and I think honestly, now that I'm thinking about it, it might just honestly be because there was more tissue on my right side, I believe, now that I'm thinking about it, because I was worried about it. I didn't know if there was potential nerve damage. It's all throughout the chest and the upper arm. Whenever I move this one, even just raising up a little bit, the tightness, I feel it just right here. While this one, I don't feel the same tightness until my arm is fully up. But I'm still doing some physical therapy stuff, just casual stretches and stuff. I'm not actually going to a professional physical therapist. I kind of know what I'm doing. You could always Google that stuff of suggested physical therapy stuff to do for chest surgeries. But I mean, I've been to physical therapists when I was younger. I played sports, I got hurt and shit, so I kind of know what I'm doing. Pete will be very proud of me. But anyways, yeah, let's move on to sensation now. So normal feeling ends right here. And then as you move down, it's sharp, kind of pain. Not really painful, but the best way I can describe it is you literally feel the nerve waves, the nerves trying to connect and signal hey, something's touching here and anything like that towards the brain. But it's not fully connected yet. That's why you have this weird numbing mixed with pain feeling type thing. It's really hard to explain. I'm not good at explaining this type of shit, but I hope you understand what I mean. Especially in the center of the chest right here. It's really funny touching right here because it's you feel the nerve rays shock both direction and it shocks the nipples sometimes, and it's just yo, whoa, it's so weird. I still have, I don't know if anyone noticed while zooming in, this little chunk right here. I thought it was just, I don't know, it might still be it reminds me of a dog ear, but I hate how it's right here because it's excess tissue. It still might just be swollen right there though, because it has gotten down over the past month. So surgeons have said to many individuals, because people freak out, and stuff, you won't actually see the full result of your chest until 1 year post-op. But I mean, towards the 6th and 8th month mark, you pretty much have an idea whether or not you actually have a dog ear. Sometimes you can tell right away, especially with the sides and everything, which I don't. Which is great. I love that. Yeah, all along, it's very numb right here on my right side underneath the armpit and towards the side. Very numb and still feels swollen. Better on this side. More of a shocking kind of type of pain thing. So you can tell the nerves are really trying to connect on the left side more than the right. But overall, great sensation. I can't feel my nipples, but they're trying to feel that something's there. I don't know if it's just my mind memory of hey, you used to feel that, so it's trying to remember what it feels like, you know what I mean? But nipples are healing great. They just feel dead. They're not scabby, they're not dry to feel or anything like that, they just feel dead. I feel it's doing great. I personally really like my results. For scar care now, this is some silicone sheeting that my surgeon recommended and gave me. Each box should be about a month's supply. Your regular silicone sheeting, only this is Silogen. I've never heard this brand before. They're okay. So it comes in a big sheet. I cut it down to 3 strips within a sheet. Both sides are actually sticky, so you can use one side, put it on, and then once you can wash them to multiple times and just let them fully dry to get their stickiness again. Each strip should last 2 weeks on each side. They're kind of annoying because they do move around a lot. I do have to end up using medical tape just to keep it, especially on the sides. They just keep on rolling up and everything like that, especially since they're sticky. It sticks to shirts sometimes and stuff, so I put some medical tape on the center, on the side, just to keep it in place and everything. It's recommended to wear at least 6 hours every day. I've been using it for 2 weeks now, although I haven't honestly been using it every day because it is so annoying. You take it off when you shower and stuff like that, obviously. I probably do it maybe like 4 days out of the week, but I'm still gonna stick with it and just, I don't know, see if I can find another sheeting thing that just stays better. If anyone knows of any, just please comment down below like what you guys have tried. And then also throughout the day, they didn't have any bio oil. That's what I was looking for, so I just got regular skin therapy oil, anything to help with the scars. I put this on 3 times a day. I suggest putting this just in your bathroom, just like as a simple reminder, or like on your bedside table or something. It's anywhere that like is just gonna remind you to do it. Put it with your skincare products. I do it at least 3 times a day. Sometimes I do it 5 times a day. Improve the appearance of scars, stretch marks, dry down skin, uneven skin tone, and aging skin. So, you know, just anything to help out. I make sure, obviously, I wash my hands. I do this after I get out of the shower, so my chest is already clean, but obviously if I'm not doing this straight out of the shower, I might do a quick body wipe to my chest just to make sure it's all clean. Squirt on some oil, and then just like in circular motions, go along the scar line. It helps with the collagen, breaks it up and everything like that, so you don't have such risen scars. It's very important to massage them. But also, it just helps so you can get that sensation back in your chest, you know what I mean? It just like wakes up the nerves and shit. Because obviously, like, if a part of your body is just dead for so long and you're not going to use it, your body's like, okay, so what's the point of like deriving energy to this place anymore, you know what I mean? So, and sometimes I'll put some on my nipples as well, because obviously there's going to be scars around your areola, but I mean, that's not as noticeable so far. I mean, it obviously depends on how well your scars heal, and like how your skin heals with scars and stuff like that, so. But anyways, yeah, that was my 2-month update, and also my scar care routine. If you guys have any suggestions for scar care routine, what's worked for you, or what you have heard, and like what you plan to do based off your research, please, I really need it. Comment that down below. It's beneficial for me, beneficial for like everybody. I mean, obviously I know with this type of stuff, it is trial and error, unfortunately, because everyone heals differently. It depends on your skin type and stuff like that, but any information that you guys have will definitely help me out. Look at the statistics. If you find yourself watching multiple of my videos, might as well subscribe, and don't forget to click that bell down below so you get notifications whenever I upload. And I'll see you guys next time. Bye.